So when we come to apply our knowledge of LabVIEW to design a pulsed oximeter, we'll be trying to measure changes in the absorption of light, red and infrared light, as your blood passes through your finger. These changes will happen at around about a 1 to 2 hertz time scale. So your pulse runs with cycles of around about 1 second or half a second. Okay, so to help us start to understand and record dynamic data that changes on about that frequency, we've developed a little pendulum, and the pendulum is going to allow the piece of red absorbing film to move between the light emitting diode and the photodiode, so that when you swing the pendulum, you're going to be able to record a changing time series of absorption. Okay, so a few things to note here. The pendulum that we've built will plug into the MIDAC board here, but it's quite a tight fit, so be careful and hold on to the lower part of the leg when you push it in. Also, if you're using the power rail, make sure you don't short the power rails with the conducting wire that makes up the pendulum. When you attach the red bob here, make sure that it passes freely between the photodiode and the LED. Make sure there's enough space and that it works on that track. And also, if you locate the photodiode and the LED to one side of the central point of the pendulum, you'll make sure that you actually have a kind of 1 cycle per second, or you'll have the red film pass in front of the photodiode once every cycle. If you put it in the centre, you may get it passing in front twice every cycle, so you actually double the frequency rate. Okay, good luck with that.